You know, unfortunately, all those groups that had access to the process, who then in the end, they all got sort of kowtowed into going along with it. Now they're all being hit with these huge tax bills because everybody's getting taxed to pay for this thing, all of which is passed on, I might add, to businesses in this country, driving up their costs. But the one thing that everybody has mentioned here this morning, which I think that didn't really have a seat at the table, were the states. I mean, think about the states and what this means for them. You're actually passing on, in the first 3 years, the federal government says it's going to pay 100% of the cost of the new populations that are going to be covered under Medicaid. But if you look at what happens after that, the states then are starting to have to share or bear more of the burden and be forced to pay at least another $118 billion, according to one congressional report, through the year 2023, which crowds out priorities like education, law enforcement, and all the things that we expect our states to do. And so the states got all these mandates shoved down their throats, making it more difficult for them to meet the responsibilities they have to the people in their individual states, because the federal government has not only said you're going to have to pay for this, but they've also become very prescriptive about what you can and can't do. And so states no longer are going to have, and frankly haven't had a lot of flexibility even in the past when it comes to setting eligibility standards, determining who can and can't be covered by Medicaid in their individual states. They just get the cost shoved down their throat, very little input into how they're going to implement this program, and so much so that governors all over the country are reacting to this, and that's why you've got 26 governors who are part of the litigation that's going on right now at the Supreme Court to challenge the mandate on Medicaid, which will be heard today by the court. But listen to what some of the governors around the country have said, and these are Democrat governors. This is the Democrat governor of Kentucky. I have no idea how to pay for these new mandates, regulations. Former governor of Tennessee said, I can't think of a worse time for this bill to be coming. Nobody's going to put their state into bankruptcy or their education system in the tank for it. The governor of Montana said, I'm going to have to double my patient load and run the risk of bankrupting Montana. Those are Democrat governors reacting to this new mandate that's being shoved down their throat because of the changes that were made to Medicaid in the health care bill. And so I think that the states, unfortunately, did not have a seat at the table. If they did, they certainly didn't get their voices heard, because they are going to be forced now, and the people, individuals in these states, to come up with the billions and billions and billions of additional dollars that they're going to have to pay to finance the new mandates in the legislation. Now, I want to make one other point, because, you know, there's been a lot said here on the floor of the Senate and by just people, I think, generally in Congress, about the importance of focusing like a laser on jobs in the economy. And frankly, I think that there are some things that actually have been done around here. Last week we finally passed a jobs bill, a private sector jobs bill, that would create jobs, hopefully make it easier for our small businesses to access capital to grow their businesses and create jobs. But the health care bill clearly is going to have the opposite effect. Now, interestingly enough, when it passed, there were lots of statements made at the time about how many jobs it was going to create. In fact, if you go back, the former Speaker of the House said that it would create 4 million jobs, 400,000 jobs almost immediately. That's former Speaker Nancy Pelosi. Interestingly enough, that contradicts what the Congressional Budget Office director said. He testified that the new law would actually reduce employment over the next decade by 800,000 jobs. Now, there's an analysis done by UBS that stated that the law is, and I quote, arguably the biggest impediment to hiring, particularly hiring of less skilled workers. And so what we're seeing, again, is a promise made about creating jobs, and the very opposite, I think, is what you're going to see. Now, there was a Gallup poll just recently that found that 48% of small businesses in this country are not hiring because of the potential cost of health insurance under the health care law. 46% are not hiring because of concerns over other government regulations. But if you look at the impact that this legislation is having on hiring in America today, what we're hearing from the people who hire, the job creators out there in our small businesses, this is a huge impediment to hiring. The device manufacturer striker announced that they're shedding 5% of their workforce over concerns about the impending 2.3% medical device tax, which was included in the health care law. There is another employer here. This is somebody who owns restaurants in this company, a restaurant chain. Let me state bluntly, this is a direct quote, let me state bluntly, this law will cost my company more than we make, end quote. Cost the company more than we make. Another employer in this country said this: the new health care law has wrecked our plans to grow our business and create jobs. Madam President, that is exactly the thing that I think many of us predicted would happen. And notwithstanding the assertions that were made by the proponents of this legislation that it was going to create jobs, we see the very opposite happening. We see our small businesses are pulling back, not hiring, not growing their businesses because of the concerns about the costs and the penalties that will be imposed and the taxes that are included in the health care law. And so I know that my colleague from Wyoming represents a lot of small businesses like I do. South Dakota and Wyoming are not, they're very similar in terms of the size of the state, the way that people make their living. We've got a lot of small businesses, a lot of entrepreneurs, and we look to them to create jobs and grow the economies in our state. And obviously it becomes much more difficult when you continue to drive and shove these mandates, these requirements down the throats of our small businesses, these new taxes that they're going to have to bear. And the list of taxes under this is just really pretty amazing, the new taxes that are going to be imposed under this. But it adds up to, and this is just over the cost of the first decade, $552 billion. When it's fully implemented, $1 trillion in tax increases, all of which get passed on in the form of higher cost for health insurance and other costs throughout the economy. But my point very simply, Madam President, is if we are sincere in being focused on creating jobs in this country, perhaps the biggest impediment and barrier to that now is the health care law, the Obamacare law that is currently being heard by the Supreme Court. And I think that as you mentioned, the huge majority of businesses across this country, and especially small businesses like those that you and I represent in Wyoming and South Dakota, to maintain coverage for their employees. And there are just so many huge impacts from this, much of which, frankly, we predicted. But again, the idea, the notion that somehow imposing over $500 billion in new taxes on businesses in this country, on health insurance plans, was somehow going to lead to lower costs for people to get coverage in this country is beyond me. I don't know how I'm at a loss as to explain how anybody could make the argument that this was going to create jobs. And of course, as I said, former Speaker Pelosi predicted 4 million new jobs. The Congressional Budget Office had said that it would cost us 800,000 jobs. I suspect that's a conservative estimate based upon what I hear from employers in my state and elsewhere around the country. But I do want to point out, too, that in so many ways, this thing, because of the new mandates, because of the new taxes, because of the new costs, is just going to make everybody's lives more complicated, more difficult, including our states. And we represent states where our governors, our legislators work really hard to balance our budgets, to live within their means, not to spend money that they don't have. And yet here they are being forced by the federal government to swallow these additional costs that are coming because of this new health care plan. Basically what the Obama administration has done is it's put shackles on the states when it comes to making decisions about the eligibility needs in their states. They're going to have to lower spending on Medicaid providers, and in some cases, our states are trying innovative approaches to care delivery. They're trying to come up with new ways of doing this and to do it more effectively, and yet the federal government is going to make that much, much more difficult. So bottom line is that the combined effect of the health care, the Obamacare's policies, has taken power from the states, given more of it to Washington. It's forced unrealistic new spending mandates on the states that are going to crowd out those local priorities that the senator from Wyoming mentioned, like education, like law enforcement, the things that I think constituents in our individual states expect their governors and their state legislatures to deal with. And so, again, I would come back to what these governors have said, and I'm not talking about the conservative Republican governors in this country. I mean, look at what the Democrat governors have said. Governor of Kentucky, I have no idea how to pay for this. The governor, as I said, of Montana, basically saying that increasing the patient load under this bill will cause a bankruptcy or force him to bankrupt his state. And then, of course, there's even the governor of a state like California.
Republican time has expired.
Which I'll submit for the record. But, Madam President, I think the point is there are lots of promises made that haven't been kept with this legislation.